Hello ladies and gentlemen, this is Deep Science. Deep Science is a YouTube channel for students who love 3D animations. Today the topic is great blood vessels, but we shall also see their immediate branches and tributaries. So 3 criteria define great blood vessels. Number 1 is size. Of course, a great blood vessel should be big in size. Number 2 is having a direct connection to the heart. As you can see, the aorta and vena cava. Then number 3, these vessels should form a main pipeline for blood flow, either systemic or pulmonary. Now let us focus on the aorta for these 3 criteria. The heart is the first organ to get blood from the ascending aorta through its coronary arteries. Now the left upper limb, the anterior chest wall, pericardium, thymus, thyroid gland, breast, posterior cerebral saturation, spinal cord, cervical trachea, and also that part of the diaphragm are all supplied by branches of the subclavian artery, which is also a branch of the aorta. The left head and neck are supplied by the left common carotid artery, which is also a branch of the aorta. Now all corresponding structures on the right are supplied by the brachiocephalic trunk. Now in summary, what we are saying is that aorta, specifically ascending aorta and the aortic arch, form a pipeline for blood flow to the head, neck, upper limbs and the anterior thoracic regions. And next is the descending aorta. Aorta in this region gives off posterior intercostal arteries from T3 to T11. It is these arteries which branch not to directly supply the spinal cord but to reinforce its blood supply. Posterior intercostal arteries are the main contributors to the segmental blood flow of the thoracic vertebrae from T3 to T11. The posterior intercostal arteries supply the deep back muscles, also called intrinsic muscles. The ribs and intercostal muscles are also supplied from the vertebrate somewhere halfway. But we have exceptions on this. The first and second, and also the 12th ribs. The first and second are supplied by still posterior intercostal arteries but of subclavian origin, while the 12th is supplied by subcostal arteries. Subcostal arteries are the last branches of the thoracic aorta, and they supply the 12th rib and intercostal space, plus some muscles around there. Another branch is the superior phrenic artery for the upper surface of the diaphragm. We also have esophageal arteries for the thoracic esophagus. Bronchial tree and supporting structures also get blood from bronchial arteries, which are also branches of the aorta. In conclusion, what we are seeing is just the importance of the aorta in the thoracic region. When the aorta crosses the diaphragm, it becomes the abdominal aorta. We are reaching all this far, but we are indirectly looking at the importance of the aorta. Remember, our third criteria was that a great vessel should form a main pipeline for blood flow. This means that all blood moving around the body at one point should pass through such a vessel. Let us trace blood in the abdominal organs, and we see the stomach, lower surface of the diaphragm, liver, spleen, pancreas, and suprarenal glands all get blood from the celiac trunk. That one there is the celiac trunk. For today we shall talk about immediate branches of the aorta and ignore further branching so that we don't get lost. Renal arteries branch off to supply kidneys and some parts of the suprarenal glands. Suprarenal glands also get direct blood by means of the middle suprarenal arteries. For the remaining parts of the duodenum, the entire small intestines, ascending and transverse colons all get blood from a single branch of the aorta, the superior mesenteric artery. The inferior mesenteric artery supplies the remaining descending and sigmoid colons and the rectum. Now let us look behind the GIT. Lumbar vertebrae of L1 to L4, deep back muscles and the back wall are supplied by the lumbar arteries. Lumbar arteries also branch off to reinforce blood supply to the spinal cord in this area. This pattern is exactly equivalent to the posterior intercostal arteries we saw in the thoracic region. Gonadal arteries arise below the renal arteries and descend to the gonads. The gonads can be ovaries in females or testes in males. Aorta gives off the medial sacral artery for the last bones of the vertebral column, the sacrum and coccyx. Now at this point the aorta gives up and branches into the common iliac artery for the pelvis and lower limbs. For circulation to be complete, blood must return to the heart. The vessels that return blood are the veins. Among all veins, vena cava is the greatest. It is directly connected to the heart, the biggest in size, and forms the main pipeline through which blood flows back to the heart. Blood from the pelvis and lower limbs enters the vena cava through the common iliac veins. Sacrum and coccyx are drained by the medial sacral vein which powers into the left common iliac vein. Kidneys and suprarenal glands drain through renal veins. But first, the right kidney is drained by the right renal vein. On the left, renal vein is combining blood from the left kidney, gonad, suprarenal gland, and diaphragm, and returns all of it to the vena cava. On the contrary, to the left, right suprarenal and gonadal veins drain directly into the vena cava. All blood from the small and large intestines, stomach, pancreas, and spleen does not go directly to the vena cava. This blood collects into the hepatic portal vein and goes to the liver first. From the liver, blood is released into the inferior vena cava through hepatic veins. Lumbar veins drain the posterior abdominal wall, deep back muscles, vertebrae, and spinal cord. Some of these lumbar veins drain directly into the inferior vena cava, while others drain into the ascending lumbar veins. The objective of this is to create a collateral pathway between the inferior and superior vena cavas. The collateral pathway diverts blood from one pathway to another in case one is blocked. So these ascending lumbar veins move upwards to join a vein called Azygous vein. The Azygous vein then empties into the superior vena cava. If we concentrate on the thoracic region, we can see many tributaries of the azygous vein. These are draining the spine, intercostal muscles, and the posterior wall. The azygous vein receives all this blood and drains into the great blood vessel, the superior vena cava. Although there are many veins in the thoracic region, they all converge into three veins. These are the azygous vein, left brachiocephalic, and right brachiocephalic veins. The right brachiocephalic vein is for all organs and structures on the right head, neck, mediastinum, and anterior chest wall. The left brachiocephalic vein is for all those on the left. It is important to note that the heart does not drain into any vena cava. Let us first stop here with great blood vessels. Those are my references. Please support this channel by subscribing, liking, and sharing with your friends. Have a nice time.